I wanted to give a few of my thoughts on why I think the community information integration and the central patient attachment registry are important for patient care, both from the patient point of view and from my own point of view as a provider. The first thing to remember is that most patient care happens in the community. Netcare is almost entirely made up of consultation reports that happen within the AHS system, with some community diagnostic imaging and community labs, but most of the patient care reports come from within the AHS community. But that's not where the care is mostly happening. It's happening within the community itself. When I complete a report on a patient, my consultation letter, it goes back to the referring physician. And if I know the family doctor, the primary care physician for that patient, I can send it there as well. But it's only going to 2 people. It doesn't go to the vast majority of people who might become involved with that patient in the future, and especially for those complex patients that have lots of providers involved. That means that when a patient comes into an AHS visit somewhere, the people at that end don't know I'm involved. And that could be in an emergency department where they don't know that I'm involved and don't know that there may be some plans for that patient and they don't have the advantage of being able to see that stuff. Could be a AHS specialist that sees them and don't know I'm involved. So that means that they don't send me a copy of their notes on the patient, so I don't get the information that they've generated. And they could be making plans that are either different from or contrary to what we've planned up until that point. The other important piece is that when I produce a report and do good work with a patient, it'd be nice if that got known. It's kind of a marketing tool for me, so that if people, physicians, emergency physicians, or other specialists need to get somebody involved that's like me, they'll know about me and know that I do good work, and that so as a marketing thing for my practice, that can work quite well for me. I wanted to tell a little story about one of my patients. So I have a teenage autistic patient. I have several of these patients who, when they get a little bit bigger than their mums, they can sometimes get quite aggressive and quite difficult to deal with. And we had worked with this family over quite a few months and coming up with a plan of, if this works, we'll keep going that way. If it doesn't work, we'll try these next steps. And we had highlighted all that. I was able to send my report up to Netcare. And so the patient, who wasn't doing well at one point, ended up in the emergency department. The emergency doctor was able to see that I was involved. So first off, they knew they could contact me. But second, they were able to see my note and my plan. And they were able to follow the next steps. And they actually phoned me up and said, I've seen your note, I've seen your plan, we're going to follow the next steps along in the plan, and then arrange for follow-up after that. So it was a really good system, use of the system, to be able to get the patient the care they needed at the time and to continue following along the plan that we had made with the family. For pediatricians, there's a couple of other benefits that we have being involved with this community information integration and CPAR. Because we do some primary care, it's possible that we can get information from the system sent to us. There's a thing called e-notifications that allows when patients come into the emergency or get things done in the HS system, like day surgeries, those notifications can come to the primary care providers, and so I can get those notifications. Second thing, and that's coming later, is that there'll be a position or a spot on Netcare that designates who the primary care physician is, so that everybody who's looking at the patient can see who they need to contact or who they need to involve. So that's just a few of the things that I think are important when we consider community information integration and the central patient attachment registry. And hopefully that helps you to make your decisions about what you're going to do and getting involved with this part of the system.